Hello, everyone, and welcome to A&OTT 23 podcast. In this podcast, we dive into the methods to maintain sterility, bringing you insights and discussions on scrubbing for a sterile procedure, gowning, and gloving. Together, we're here to educate you, bringing valuable insights and discussions on scrubbing in, gowning, and gloving for sterile procedures. Now, let me give you a brief description on the importance of sterility. Sterility is crucial in various fields, particularly in healthcare, pharmaceuticals, and laboratory work, to prevent contamination and infection. In healthcare, maintaining sterility during surgeries and medical procedures is vital to avoid introducing harmful microorganisms into the body, which can cause infections. Sterility in an operating theatre is of paramount importance to prevent infections during surgical procedures. Infections can lead to severe complications, prolonged hospital stays, increased healthcare costs, and even death. Ensuring sterility minimizes the risk of introducing pathogens into the patient's body, ensuring a safer surgical outcome and a faster recovery.
A single lapse in sterile technique can mean the difference between life and death, success and failure. Picture this, a surgeon's scalpel poised above a patient's heart or a scientist handling a delicate sample that could hold the key to a major breakthrough. In these critical moments, sterility isn't just a precaution, it's an absolute necessity. So what do we mean by sterile technique? Sterile technique is creating and maintaining an environment completely free of microorganisms to prevent contamination. But why is this so critical? Firstly, it is about patient safety. In medical settings, a breach in sterility can introduce harmful bacteria or viruses into the body, leading to infections that can be severe or even life-threatening. Imagine a surgical wound becoming infected due to a tiny lapse in sterile practice. That could mean longer hospital stays, more surgeries, and a greater risk of complications like sepsis. Sterile technique also plays a crucial role in fighting antibiotic resistance by preventing infection from occurring in the first place. We introduce the need of antibiotics, helping to slow the spread of resistant bacteria. Now let's talk about the consequences of breaking sterility. In healthcare and lab settings, even a minor lapse in sterile technique can have serious repercussions. It can lead to infections, which may cause extended hospital stays, additional surgeries, or even life-threatening diseases. The bottom line, breaking sterility isn't just a small mistake. It's a critical failure that can endanger lives and compromise scientific integrity.
We will discuss its purpose and different types of scrubs used in sterile procedures. Let's get started. Surgical scrubbing is an essential step in preventing infections during surgery. The primary purpose is to eliminate as many microorganisms as possible from the hands and arms before entering a sterile operating field. It's all about protecting patients from potentially life-threatening infections. There are two main types of surgical scrubs: antiseptic scrub and alcohol-based hand rubs. Antiseptic scrubs use a detergent solution that contain antimicrobial agents like chlorhexidine or iodine. This method requires scrubbing the hands, nails, and arms for a prescribed amount of time, usually 5 to 10 minutes. On the other hand, alcohol-based hand rubs are a quicker alternative. They don't require water and are applied directly to dry hands. These rubs are effective and convenient, often used in conjunction with a shorter scrub routine. Regardless of the type, the goal of scrubbing is the same: to achieve and maintain a sterile field. This process is crucial in preventing infection and ensuring the highest standards of cleanliness and safety.
Now let's dive into the process of scrubbing. Preparation is the key. Start by removing all the jewelry and rolling up your sleeves. Make sure your scrub sink is clean and stocked with antimicrobial soap and a surgical scrub brush. Begin with an initial hand wash. Rinse your hands and forearms with water, then apply an antimicrobial soap. Scrub thoroughly for 30 seconds to remove any visible dirt. Now move on to the main scrubbing procedure. Using the scrub brush, clean your hands, nails, and forearms up to the elbows with the antimicrobial soap. Scrub each hand for at least 2 minutes. ensuring you cover all surfaces. Rinse with your hands held higher than your elbows to keep them clean. Finally, dry your hands with a sterile towel and don your sterile gown and gloves without touching the outer surface. That's your quick guide to scrubbing in.
Here are the common mistakes to avoid while scrubbing, gowning, and donning gloves. First, while scrubbing, avoid rushing, not spending enough time on scrubbing, and incomplete coverage means missing areas like thumb, fingernail, or forearms, and recontaminations, touching non-sterile objects after scrubbing. Second, while gowning, touching the gown's outer surface. This leads to contaminations, improper tying, failing to secure the gown properly, leading to exposure of non-sterile areas, and skipping the gown, trying to don the gloves without wearing a gown first, and at last while gloving, not inspecting gloves, failing to check for holes or tears, and improper dunning is touching the outside of the gloves with the bare hand and not changing the gloves, continuing to use the gloves after they have been contaminated. These are the some common mistakes that we have to avoid to maintain sterility.
Next, we move on to a topic that might seem simple but is crucial in many environments: gowning. So, why is gowning so important? Let's break it down. Gowning for sterile procedures serves a fundamental role in maintaining the highest standards of sterility and patient safety. The primary purpose of this practice is to create a controlled germ-free environment by preventing the transfer of microorganisms from the surgical team to the patient. As medical professionals, it is our responsibility to uphold the sterile field to minimize the risk of post-operative infections, which can lead to complications and prolonged recovery times. Each step in gowning, from proper hand washing techniques to the correct donning of each piece of protective gear, is designed to safeguard the patient and maintain the integrity of the sterile field.
Now, let me walk you through the essential procedure for gowning up before entering a sterile area. Whether you are in healthcare, pharmaceuticals, or a research lab, following the correct gowning procedure is crucial to keeping environments contamination free. Let's dive right in. First things first, the process begins even before you put on your gown. The goal here is to remove as many contaminants as possible from your body and clothes. Start by thoroughly washing your hands and arms up to the elbows with an antiseptic soap. Hand hygiene is critical because your hands are a primary source of contamination. Then the gown should be carefully picked up by the inner side. Then arms are inserted into the sleeves. Now we can ask for an assistant's help to tie the gown at the back for maintaining sterility. The gown is tied at the waist and neck by covering entire body except face and hands. This coverage is essential to maintaining the sterile field during the procedure. By following these steps, you are ensuring that you are fully prepared to enter a sterile environment without introducing contaminants. Remember, every step in this process is designed to protect both you and the integrity of the sterile field.
Now, let's discuss on the topic of objectives of wearing a sterile gown. During operative procedure, any part of a body of a surgeon or an assistant may touch the operative area and there is a chance of contamination. To prevent such contamination, the use of a sterile gown is necessary. Normally, our body secretes sweat which contains bacteria coming from the sweat gland. The sweat can percolate through the garment, but sterile impermeable gown does not allow the sweat to contaminate the surgical field. Surgical team members with sterile gown have enough freedom to move around the operative field. Back flap of the gown can provide extra protection towards touching the instrument trolley inadvertently. That wraps up our discussion on the objectives of wearing a sterile gown. Thank you.
Now let's hear about the last step in the process, that is gloving. We all know that sterile gloves act as a barrier between the hand and the operative field. The main purpose of gloving is that it prevents the contamination of the wound from the organism present in the finger and also prevent direct contact of blood and other tissue fluid of the patient to the fingers of surgical members and vice versa. It also helps in handling sterile objects without contaminating it. Now, based on composition, gloves are classified into lactose, nitrile and vinyl. Gloves made of lactose could be powdered or powder-free. Vinyl gloves proved to be of high quality yet cost-effective. Now, when it comes to nitrile, they are both protein-free and lactose-free. Hence, they do not inflict lactose allergies on prospective users. These gloves are the most durable. They provide a higher level of protection compared to the other gloves because they are chemical and puncture resistant. Thus, they are most commonly used in the medical setup to maintain sterility.
Now let's dive into crucial part of maintaining sterility, the proper technique for putting on sterile gloves. This step is essential for preventing contamination and it's something we need to get right every time. So let's walk through the process together. First, prepare your work area, making sure it's clean and organized. Next, open the outer packaging of the gloves and place the wrapped gloves on a clean surface. Before you move on, take a moment to wash your hands through the soap and water for at least 20 seconds. Then dry them. When you are ready, put first glove. Grasp it by the cuff and slip it on without touching. For the second glove, use your gloved hand to pick it up by the cuff and carefully put it on. Once both gloves are on, remember, keep your hands above waist level to maintain sterility. And if you any point think the sterility has been compromised, it's important to start over with a new pair of gloves.
Episode Recap. In today's episode, we explore the critical steps of scrubbing, gowning, and gloving, which are foundational to maintaining a sterile environment in surgical procedure. We started off by discussing what is the importance of sterility and why sterile techniques so vital. It is the frontline defense against infection and key factor in ensuring patient safety. We walked through the scrubbing process, highlighting how through hand and forearm cleaning helps minimizing microorganisms on the skin. Next, we cover the topic of gowning, where the sterile gown acts as a barrier between the healthcare worker and the patient, preventing contamination. After that, we discuss the importance of closed glove technique, which adds an extra layer of protection by keeping hands sterile during the procedure. Finally, we emphasize the ongoing need to maintain the sterile fit throughout surgery, as even a minor breach can have serious consequences. By mastering this technique, healthcare professionals uphold the highest standard of safety and care in the operating room. Thanks for tuning in, and remember, sterility starts with scrubbing, gowning, and gloving.
To keep patients safe during surgery, it is crucial that all healthcare workers carefully follow the steps of scrubbing, gowning, and gloving. These are not just routine tasks, they are essential actions that helps prevent serious infections. Every time you scrub your hands, put on a sterile gown and wear gloves, you are protecting your patients. Let's commit to doing these steps properly every time. Ensure we give the best care possible to those who trust us with their health.
Thank you for listening and hope to join you again soon.